Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today's Friday, August 20th, 2021. I want to thank you for joining for a COVID update today. We're going to get right into the numbers. And we continue to talk about the fourth surge and the Delta variant and what it means for our area. But I want to take a step back to last Saturday. It was a great event. I want to thank our partners and Roger with Pilgrim's Pride and the whole corporation for what they did and the team that they brought. I want to thank the volunteers from Titus Regional Medical Center who went as well. But we had a great day at the Civic Center. Hopefully you saw me on the side of the road holding a sign. You can see their team members, Taylor, you can see Henrietta there, you see Melissa holding signs up, trying to get people to come off Highway 271 to get their vaccine on Saturday for a chance to win Meat for a Year. It was a great event. But Roger Brandon and the team at Pilgrims put that up, and then the city of Mount Pleasant helped sponsor this with us. So it was a great event. It was a phenomenal turnout. It blew my expectations out of the water. And what I loved about it was, and I was standing out in the heat on the side of the road, but I enjoyed seeing families come in, where you had the parents and the children who go into school a couple of days later all getting the vaccine together and getting the same shot, so they would all do it together. It was pretty emotional. It was emotional to see that, and you could just see those people in that family doing it together. But we did make a difference on Saturday, and you can see that in the numbers that we'll talk about today. But I want to thank everybody who was involved in that process. Carmela, you see her there. We went back and forth on several Facebook Lives and did some things, just try to have fun on Saturday and get people in the door, and it worked. So thanks, Henrietta, thanks, Pilgrim, and thank you for the City of Mount Pleasant for supporting us and working with us. I want to get into the numbers and start talking about it. You can see from a regional's perspective, this is across the state, and want to call on a daily basis with the other hospitals around Northeast Texas. So you're seeing their numbers and seeing the increase, and you're seeing diversions. Our emergency department is we're not going on divert. We're going to keep our emergency department open for this community, and we're committed to doing what it takes. You can see from a region's perspective, Paris to Texarkana to us, up to 183 beds, ICU beds about 6 and 4 going back and forth. We did have a few staff nurses join a few days ago in the region. Titus Regional asked for 40 nurses. We got 3. But you know what? I'm not going to sit here and complain. I'm going to take what we can get and just thank the good Lord above for everything He's given us. But you can see a few ICU beds came available in the region. That's going to help from different areas. We are on a daily basis helping people from Bowie County, from Lamar County, who are calling, can't get in, and we're trying to get them in here and do things. So you can see the difference it's making. In the hospital today, we have 18 COVID patients. 12 are capped. We've got 15 on the floor, and we have 3 in the emergency room. With those 3 increased nurses and some more volunteers from our team, we've been able to increase from 12 to 15 and hold them on the floor. We've got 10 on the floor in the COVID area, and 5 in the ICU. So that's the concern right now, is holding the patients, not only COVID, but we're holding hospital patients too, because we're limited of hospital patients we can put in. So that's the concern. That's the risk that we're running into right now. And that's what we just want to make the community aware of. I saw a few things that I wanted to get excited about. The only way we're going to mitigate this spread is vaccinations. And that's the truth. One thing, when I printed the numbers a minute ago, Titus County, as of yesterday, we hit 46% of first dose eligible, 12 years and older, getting their first dose of vaccine. That is above the regions of 43% and a long way from where we were a couple months ago when we were at 21% and were the lowest in the region. We're now at 46% and we're above what the regional number. We're at 35% fully vaccinated, which is the highest we've been, and we continue to increase. So over the last 2 weeks, we've made significant increases in our first dose and full vaccination. And I truly appreciate everyone who's come out and got those vaccines. I also want to talk today, before I get into the booster shots, let me just go back to vaccines. I saw a question come up that prompted something that was asked this week, been asked 3 or 4 times. Hey, Terry, I got my first dose and I didn't get the second dose. Well, I talked to Dr. Thurman, who talked to an infectious disease doctor from Northeast Texas that we're very close with and works with us, and just want to make sure everybody in the community knows if you got your first dose, you didn't get your second dose of Moderna or Pfizer, they're encouraging you to go ahead and get the second dose. It's better to get the second dose, irrespective of the difference in time, than not get the dose at all. You don't have to go through the treatments again. You just get that second dose. So if you only got first dose, go get that second dose if it was Moderna and Pfizer, and you'll be on to decreasing the spread with the rest of us in Northeast Texas. The talk this week is boosters and third shots and boosters, and it's really confusing. I mean, Angela's had a bunch of discussions this week about it because it's a really confusing topic. Is it a booster shot or is it a third shot? Well, on Monday or last Friday, right after our announcement, they did come out from the CDC and the FDA and recommended a third shot. So that third shot, not a booster, but a third shot was recommended for 6 different types. Now, there's not a ton of people who fall into this, but they did recommend for some people who are receiving active cancer treatment, organ transplant, stem cell bone marrow transplant. You can see the list there. Moderate, severe immunodeficiency, those diseases specifically, and advanced or untreated HIV, and then the active treatment with high dose of certain medicines. Because you can see there, it's a small percentage. It's not everybody. There's been a lot of confusion this week, and I just want to make sure everybody understands those are the 6 things that the third shot's being recommended for. And it's being recommended 28 days after your second dose. Pfizer or Moderna, doesn't matter, 28 days after, they're recommending that third shot. So if you do qualify, we are giving it in the vaccine clinic, and I would encourage you to come and get that third shot. You'll have to attest that you meet one of the qualifications, but you can get the third shot. Now, yesterday, we got more information that there's going to be a booster shot. That's going to be recommended at 8 months, and it's going to be a third shot as well. We are going to have the booster shot available. We're working with the state of Texas to increase our vaccine inventory here so we can accommodate that third shot. It's not really a booster shot, it'll be a third shot. It'll be 8 months after your second shot. So we'll be working over the next few weeks to get that process down, but we will offer that third shot when it clears up. But we do have a third shot available, and then the booster shot will be in 8 months, but it's going to be the same shot after. If you have any questions, hit us on Facebook. We'd love to answer more. I truly appreciate Dr. Thurman and Dr. Yates for clearing that up. We do review those protocols with our team, on our medical staff task force team, so all the doctors at Titus Regional on the same page. We did move our clinic last week. We talked about it. It was a pretty easy week, so we didn't have as many people going to the old site. So, again, I apologize, and I'm sorry. And there's signs across town that say go to the hospital, and we've needed to move it so we can expand our emergency department. It's gone great over there. It's a good facility. It's right over there at the medical plaza at the Wellness Center. You'll see the signs up. We've got a great big Vaccinate East Texas banner in the driveway. You can't miss it. It's open Monday through Thursday, 7:30 to 1:30, and on Tuesday, 7:30 to 7:30. I'd encourage you to go get your vaccine. If you have not been vaccinated yet, go see Angela, go see Renee and the team and get your vaccination and help us mitigate the spread. One of the things we've done this week, because the increase in the clinics and increase in the emergency department in the hospital, is we welcome back to All American Testing, who opened up a testing center here in Titus County. It's opened up right across the street from the entrance to the hospital in the parking lot there. I want to say it's 109 West 20th Street is where they're located up, but it's a parking lot, and they have signs up across the south entrance street from the south entrance of the hospital. So I would encourage you to go online, allamericantesting.com. You can register for that COVID test. It's not part of the hospital. It's just a group who's working with us to provide that. So to help people in the community who want to be tested, asymptomatic, with symptoms and not with symptoms, you can be tested there. But it's something we haven't been able to offer in the last few months, so we're glad to have them back. You know, as we move on and we continue to encourage vaccinations, I'm going to continue to encourage you to wear your mask everywhere you go. It's one of the ways that we can help mitigate the spread, so we'll always push to wear your mask, to wash your hands and social distance. I know we're starting football season, scrimmages the last few weeks, and the real season start next week. I'd encourage you to wear your mask anytime you're indoors. We are encouraging all students to wear their mask indoors as well. We believe, and our medical staff believes, it's the right thing. So you'll see the hospital continue to encourage to wear the mask because it will improve and mitigate the spread. I want to thank my team again at Titus Regional Medical Center, the doctors, the nurses. I know I do this on a weekly basis, but every week I'm blown away by the things that I witness and see and read about within our health system. And I want to thank each of them for what they're doing. And if you get a chance, I had an opportunity to be on the radio this morning. If you have a friend or a family member who is a nurse or a lab tech or a doctor, anybody in the clinical medical field, they may be a registration because they're seeing it as well. But if you have a friend or a relative in the medical field, reach out this weekend, shoot them a text, tell them you love them, tell them you're thinking about them. They're struggling. Our nurses are struggling at this point harder than they did at any time in the previous 16 months. Seeing death is not something we do on a normal basis in healthcare, especially in rural healthcare. And everything that happened over the last few months, and you're seeing it happen again. And I feel for these people, and I pray for my team on a daily basis. And that's the only person we can live to get support. So if you get a chance this weekend, reach out to a friend or a family member. Just tell them you're thinking about them and tell them thank you for being a hero and saving lives. Again, we'll be here next week. We'll continue to give updates. We truly appreciate the support of Northeast Texas. Thank you. God bless.